Top 5 things that cause complications after surgery. 1, overactivity, not listening to your surgeon. When your surgeon says to chill out, that means you chill out. That doesn't mean walking your 100-pound Great Dane around the block, 2 days after surgery. That doesn't mean going to the gym and just casually walking on the treadmill or the elliptical a week after surgery. That doesn't mean like doing house cleaning, within a couple days after surgery of a tummy tuck. The point is recovery, and overdoing, I can almost guarantee you're gonna have some form of delayed swelling, or you can even cause complications associated with bleeding. 2, having pets in your bed after surgery. Terrible idea. I cannot tell you how many problems I've had with that. I would say my top 5 bad infections I've had associated to surgery, cosmetic surgery, all had cats. Don't get offended, cat lovers. I'm not trying to hurt your feelings here. I'm just telling you, it's cats. There's something about cat dander. There's something about their skin flora. Whatever it is, my bad infections have all had cats in common. But cats, dogs, again, you don't want these animals in your bed. They're running around and they're outside and whatnot. They're in the litter box or whatever it is. But animals in your bed do create some kind of dander. There is a different, bacterial flora associated to their dander. And it's in your sheets and it's touching you and you have fresh incisions, and then the next thing you know, you're starting to have redness around your incisions. You can't figure out why. What did I do wrong? Because a dog is sleeping next to your head after you had a facelift. That's why. 3, dehydration. Oh my gosh, this facet of recovery is so underappreciated. I cannot tell you how important to have water is after the procedure, to be hydrated. Water is we're made up of water basically, and protein. That's really what we are. And when you're not drinking enough, what happens is that everything gets worse. Like your pain gets worse. You start retaining water, because what's happening is your body's pulling water out of the muscle cells. It's pulling water out of the intestines to go into the areas of surgery. And that's what causes inflammation, is swelling. It causes swelling, and that's what your body's trying to do. It's trying to get all the cellular mechanisms to start the healing process in the surgical area. So it's pulling water out of everywhere. And so what happens, you get dehydrated very quickly, and you start feeling bad. You start getting headaches. You're taking medicines. You can't process medicine appropriately because your liver don't have the water to digest and metabolize the medications you're taking, because you're taking usually 3 to 4 of them. And then you don't move, and then it just snowballs. It potentiates everything associated to the recovery. So I cannot emphasize enough. If you're not a water drinker, prepare for it. Before surgery, start kind of increasing your water intake, and I guarantee you have a smoother recovery if you're drinking more water. 4, submerging in water with fresh incisions. Terrible idea. Again, there's some people that just cannot live without being in a bath. What happens is they can get these infections associated to their incisions because their incisions are not closed microscopically when they get into like a bath water or in the pool, like within a week or 2 weeks after surgery. It's just, the water, what happens, it kind of wiggles its way through microscopically through the incisions, and then it causes bacteria with that water. And then you get these crazy bad infections. And if you have implants, oh my gosh, even worse. Like once you get, bacteria around an implant, it's really scary. Like you can, you don't want to have that infection stay around the implant, because once it gets around an implant, that risk of having that implant having to be required to be removed is, fairly significant. 5, smoking and nicotine. Again, something preventable. It just takes your self-control not to do it anymore. Smoking before and after surgery causes disastrous complications associated to skin loss, soft tissue infections. Like I've seen patients lose like whole sections of skin after like a tummy tuck, breast surgery, face surgery. Like you want to see something scary, Google search it. What happens with smoking? They're like, oh well, Dr. Morales, I only vape. Guess what? All this new vape stuff has nicotine in it, and more other kind of crazy chemicals. Like we don't even know what's in this stuff. Like those chemicals, and especially the nicotine, the mechanism is called vasoconstriction, where the blood vessels actually squeeze down. And so when you have big incisions, like a tummy tuck or a breast surgery or a facelift, you need the blood to get all the way to the edges to heal, right? And you need all the way. And then what happens with the nicotine present, the vessels squeeze down and the blood doesn't get there. And so it stops short, and then the edges of the skin just die. They just die. and you'll have these holes. We're talking about holes. Try to avoid those complications. These are very common things that people do before surgery, and just have some self-restraint, stop these things, and you'll have a smoother and safer recovery. Again, thanks again for following me. Appreciate your comments, and stay tuned for more.